EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon and welcome to Community Conversations. Every week I think about the guests that I'm going to have a conversation with, and every week I can't help but be amazed at the wonderful resources that we have in this county and how fortunate I am that they agree to come and have conversations with me. Of course, if I made them pay, it might be different. No, I'm kidding. I'm kidding. The reality is that we recognize that while Treasure Coast is an important asset in the community, it's not the only one. We have so many wonderful resources, and some of them are like candles under bushel baskets. You don't see them unless you take a little peek. And so that's what most of our conversations are like. And I apologize. I have a cough, and I'm trying not to cough, so I have a cough drop in my mouth, and it's making my saliva glands work overtime. So there, we're done.
There she goes again.
Out of cane. Yep. Here's one for the bloopers tape. So without any more to do, I'd like to say welcome to Matt Markley, who was with us a couple of months ago, and we had such a wonderful conversation. I invited him back from the Hibiscus Center.
Thank you.
And not wanting to hog the show, he brought his best friend, Christine Finch, who is a licensed clinical social worker over at mental health. Yes. Okay, so sorry. They are different tracks. I apologize.
That's okay.
In any event, we're here again to talk about the resources that you all provide to the community. Many of our folks know that you have a place in town, a residential spot for teens. But you do a whole lot more. So we'll spend some more time talking about that. But let's start, for those that might not have heard your first conversation with me, about the Hibiscus Children's Center and how long it's been there and how long you've been there.
Well, I'm glad you asked that because this year is our Hibiscus 40th year. Hibiscus has been in the community now 40 years, incorporated in 1985, started taking kids in 89. And since 1989, Hibiscus has provided 475,000 safe nights for kids on the Treasure Coast. Yeah, it's an awesome organization. I've been with the organization 7 years. I've been in community mental health for 45 years, and this is the best organization I've worked with. And I'm not kidding you.
You were teasing her about how old she was.
I know.
And you just admitted to 45 years.
Well, it's okay if a guy, admits it, you know. Look at my hair, look at my face. You can tell how old I am, so I can't hide it, you know. But first and foremost, Hibiscus, if you don't mind me telling about it, Hibiscus is a child welfare organization. So if a child is removed from their home because of abuse or neglect, and the state of Florida cannot find a family member or a friend to care for the child, they call an organization like Hibiscus. Now, they may call other organizations as well, but we probably get 30 to 40 referrals every month.
Wow.
And we take kids from all over the state, by the way. Our main focus service area is the Treasure Coast. However, we are a statewide certified child welfare provider, rather. And so we will take kids for, anywhere in the state.
From what age up?
Well, from infant to age 17. If a kid turns 18 while they're with us, we can no longer provide them services. And by the way, kids are with us from a week, 2 weeks, 6 months, sometimes years.
Yes.
And we've had, since I've been with the organization 7 years, we've had at least 20 kids age out of the system, turn 18, and be with Hibiscus. Yeah, we have kids for 3 and 4 years.
Wow.
Yeah.
So,
and we're their surrogate parent.
I was going to say, so this is an adjunct to the foster care system.
Correct.
If there's a spot available in foster care, they might be placed there.
They might be placed there, yes. But if they're not a spot or not a good spot, you know, they try to match kids up with the right foster parent, obviously. They'll call Hibiscus. So we're the last resort, but I believe we're the best resort because of the services we provide to the kids. We don't just provide room and board, 3 hots and a cot.
Right.
We have mental health therapists on staff. They're our mental health therapists. We don't bring them in from the outside. A child can see a therapist anytime he or she wants. They do see the therapist once a week. I think you have groups too, right? But if a child is in crisis, they can ask for a therapist, and that therapist will come to help them. So that's different than most other agencies. We also have an educational coordinator. So when the kids come in, some of our kids come in 3 and 4 grade levels behind.
I can believe
2 and 3 grade levels probably
Disruptive
behind.
homes are not good for education.
Some have not been in school at all.
Yeah.
So we have to be responsible for making sure they go to school, and we do that. We make sure they get their homework done. We make sure they're what's their plan called, the 504?
504s and IEPs.
IEP plans. We make sure those are, so we coordinate all that with all the schools. And today, I think we have 24 kids at the village in Vero. That's for older kids. And then we have an emergency shelter in Jensen for younger kids, infant to age 12. And I think their census is 18 or 19 today. So we take care of 40 to 50 kids Hibiscus never closes. We're open 365 days a year. We don't close for holidays, weekends, or hurricanes, frankly, or tornadoes.
Like a hospital. Only care for children.
But may I say one other thing? I'm sorry, I'm hogging the conversation here. But I want to bring Christine in because people know about that. People know what Hibiscus is. Many people know. What they don't know often, though, is that we have a community mental health program that has been in operation how long? 15 years, 20 years? I don't know, something like that. So we send therapists out into the community, and I won't steal all her thunder, but master's level therapists go out in the community and provide services in the client's home, the school, a natural environment, wherever they can find the client. So the client doesn't have to come to us. We go to the client. And I think that's an awesome service.
That is fantastic.
We helped more than 600 families last year.
Wow. And you know, the need is great because the stress that most parents are under, whether it's economic, education, children, spouses, whatever, it's intense.
Definitely seeing different things going on with the families than we've ever seen. Like Matt said, we have a wonderful community outreach program. Currently, we're servicing over 400 clients right now.
Amazing.
And we do go to the home, the school. They can come to us if we've got to meet at a park, if the home's not a safe place. I think our biggest program I'm most proud of is our sexual abuse treatment program. We're only one of 14 agencies in the state of Florida that are allowed to do this.
Congrats.
And so we have extensively trained therapists that provide that program.
And is that a family type program? Is that for the victim?
It's
all the above.
Well, yes, it can be. So the victims, of course, and then what we have that goes along with that is called the non-offending caregivers program. So if that's the parents, the grandparents, or whoever gives support to that child, we also bring them into the program as well, so that they're processing how to better support the victim, give them some tools and resources to help them. And then that way it's a whole family healing thing. We have, I think, 8 of us of 17 that are trained in that program. And we start at age 3 if they're pretty verbal. It just depends. I kind of do an assessment when they come in to see where they're at. And then up until 18. And of course, the parents, there's no age.
And so one of my questions, again, knowing so many different caregivers in the community, if a foster child was placed, if a child was placed under foster care, but had that history, can you help the foster families then as well?
Absolutely.
Okay.
Yes. It's
because the anger that they show afterwards is
it's
understandable, but difficult for family dynamics.
Absolutely. So no, we want the child to be whole. We want the family to be whole. And the family participation is what's key. If that child has that support and feels that they're believed and they're valued, it makes that healing process a whole lot easier.
And that they're going to be safe going forward.
Right. And that's the biggest thing is teaching them the safety as well as, what things to look out in the future. But it also, most of these kids have other trauma on top of it. So we address the whole child. and the
marvelous.
family. It's amazing.
I don't
it's
blame you
wonderful.
for being proud of that
I
program.
am very, very proud of it.
That's a very unique skill set.
Yes.
And that you keep doing it. The burnout rate for therapists,
It's hard.
It's very hard.
I don't know how they do it.
Yeah.
I really don't. I don't know how
To
they
deal
do it.
with individuals under that healing situation.
Well, it's hard to, not take it home with you as well. And our director, Lacey Buxton, and myself are on part of the core team for the state for helping and developing other programs and mentoring other agencies as they come on board to provide this. But we have it in Indian River, Martin County, St. Lucie, and Okeechobee County. And we're the only agency that provides that expertise level of sexual abuse and trauma.
Well, there is another organization I'm aware of that does help with some healing afterwards, but I think they're more adult-based.
Could be. There's a lot of different agencies. We welcome any referrals from anyone. Wonderful that we have such a great reputation that a lot of those agencies will call right away and will take the referrals. We have no waiting list. We get those families in as soon as we can.
If someone heard this, not to interrupt what I am, because he's right, you'll just keep talking.
I'm shocked. Hold on. No.
If someone hearing this broadcast either knows or wants to talk with you more, would they just call the Hibiscus number, or how do they get in touch
They absolutely
with you?
can, and we have our
Can they
website.
send you an email? Sometimes
and yes,
conversations are tough.
Absolutely. My email is on our website. I think we're all on there.
All listed. Yeah, they're all listed.
If they call anybody and they ask for the community outreach program or ask for Christine Finch, Lacey Buxton, they're going to get right to us.
Okay.
And we would absolutely welcome to speak with anybody to provide them any kind of information.
Your website is? He's looking it up.
No, I'm looking up the phone number, but hibiscuschildrencenter.org.
Okay.
It's up on the. I think it's up on the screen. But I also have the number, Vicki, if you would allow me to say
for those that are in the car or
Sure.
listening to this broadcast instead of seeing it by.
Right. And the number they would call for community outreach is 772-340-5750, extension 170.
Okay. We will take a short break for a word from our sponsors, and that will give you all an opportunity to grab a pen and pencil or paper or lipstick or something to write this down with when we come back. Stay tuned. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Reserve time for Mom at Marsh Landing. Enjoy Mother's Day specials like Low Country Benedict, Peach Cobbler French Toast, roast beef, or Parmesan crusted chicken. Share a monster Bloody Mary pitcher and celebrate Mom this Mother's Day at Marsh Landing Restaurant in Fellsmere.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, and all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal Coastal Living, Four Seasons, Braxton Color, and Capri. We're also the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Pollywood. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Right now, we're having a spring sale with lots of great markdowns and discounts on everything you need for your Florida home, including all pictures, lamps, and accessories half price. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet store directly across the street, filled with lots of brand name closeouts and sale items. And visit our website at sunshinefurniturecasual.com.
Evergreen Media is your go-to for podcasting. Business owners, boost your brand by educating clients with your own show. Just show up. We handle everything else. Get your custom video podcast on Facebook, YouTube, and more. Start today at egreenmedia.com.
And welcome back to Community Conversations. If you're just joining, my name is Vicki Soule, and Community Conversations is about exposing all of us to different ideas, different resources in the community, different events, things that are going on practically in our own backyard. Although many of the organizations that come and chat with me do have a further outreach. Many of them are covering 4 counties, as is the Hibiscus Center. Matt and Christine are here today. Matt was here a couple of months ago, so yes, we have had Hibiscus here, but we talked a lot about the residential program at that time, and Matt asked if he could come back and brought Christine because of their community outreach services that they provide, which I have to say, that's like a light under a bushel basket, truly, because as many years as I've been here, I didn't realize how many families you interact with.
It's amazing.
It is. It's just amazing because we know that mental health, really got a kickback from COVID. A lot of our kids particularly were affected. Stay home, don't socialize. That's not human nature.
Right.
And sometimes home is not a very pleasant place. And that's where your residential comes in. But it's nice to be on the preventative side as well. And I think that's probably where you're making a huge impact.
I believe we are. I believe we are. The success rate is outstanding. To see the kids move on and be successful, and it's hard because you don't want to let them go. You become attached as well.
Well, yeah, 18, seems like a ripe old age when you're 16.
Yeah.
But when you get fully into adulthood, you realize how little they really know about life and protecting themselves and moving on in a successful way, how one foundation lays the brickwork for the next layer and the next layer. Sometimes they just want to jump right ahead because after all, they're invincible, right? We all were at that age.
Yeah.
Exactly.
I can't remember that one.
Then you didn't screw up enough. Sorry.
That's a whole nother talk.
I'll bet she did.
Yeah, exactly. We
could probably have a whole program on that.
We won't go there, I promise. So I recently had our gal from Safe Space here, Safe Families, I'm sorry, Safe Families for Children. Do you have some connection with them as a resource?
Yes, they refer also as well. There's so many agencies we work with in and outside of Hibiscus.
Okay.
One of the things Matt and I were discussing earlier is we have one of our offices located in a CAC setting, which when the child comes in for trauma or for abuse, there is it's a whole core team. There's the detectives, the CPT team, the victim's advocate.
Okay, so, you can't use those initials because I'm still struggling with CAC.
It's the Child Advocacy Center.
Yes.
Thank you.
Sorry.
And it's one-stop shopping.
Yes, one-stop shopping.
We all do that.
Yep.
I'm sorry.
So basically, we have an example. We have this family who's been through trauma, sexual abuse, domestic violence. So the family comes in. The interviews are conducted there. The DCF workers, if they're involved, are there. The detectives are there. There's forensic interview rooms, so the child doesn't have to keep repeating themselves over and over again.
Yeah.
We're there as support during that time for them as therapists. And then they can literally get their referral to us from the victim's advocate right there. We set up their appointment for their intake. Sometimes we do it that day, depending on the level of trauma for the child. If they've had an exhausting day, the last thing they want to do is sit and talk more. So that lightens the load on them. And so then when they do come back, they're familiar. They have, a little bit more comfort, if you will. We work with the victim's advocate. We have the therapy dogs there, so that, again, the whole child and the family.
I think that's a pretty unique way of doing things.
Yeah.
So, we try to make sure we have one-stop shopping for convenience and that familiarity and all of those same rationals. But hopefully we're not dealing with the same trauma types of things. Although for some people, just going to the dentist is traumatic. So you didn't find that funny, huh?
No, I think I hate going to the dentist. So I know.
Not funny at all.
Not funny at all. No.
So I really admire that. And you've talked a lot about trauma. What kinds of trauma besides sexual abuse are you seeing as referrals?
Domestic violence,
Seems
homicide.
to be a big one, huh?
Well, and I think there's a huge trend of substance abuse and death by substance abuse, grief. We have a lot of children who are being raised by their grandparents and their great-grandparents.
Yes.
So, which, sometimes it's hard as a parent if your child was addicted and, died by substance abuse for them to admit there was underlying issues. So then you have their child and,
So there's a partnership that we should probably take offline because Treasure Coast Community Health helps people with substance use disorder. We work with people that are in the jail now providing health care. And then we recently received some additional funding from the feds to help transition them out. And one of my biggest concerns is that we've got families involved. It's not just the individual that's been incarcerated. This release affects them, but it also affects potentially their family.
Absolutely.
Or it doesn't because they have had to kind of sever that relationship, and that individual that's being released would like to reignite, but they know they've got some work to do too, relative to, staying on a clean path and getting employment and all of those things that are wrapped together.
It's hard for a child to understand that their parent didn't choose drugs over them. They love them. The drugs chose the parent in a sense,
state.
Yeah.
It is a
Without
disease,
a doubt.
yes.
And so for kids, they deal a lot with the abandonment and why didn't my mom and dad love me? Why did they do? So that in turn turns into a lot of negative emotions and behaviors and self-worth feelings. And then you got the grandparents starting all over again. And, they're trying to get on board with, technology and all these things. So it's a difficult. That's been a huge trend. And then, of course, the other trend that is on the uprise, which is just devastating, is the human trafficking.
Yeah, we don't talk enough about that. We would all like to think that that's not real in our quaint town.
Yeah.
And I would agree. It's tough to talk about, but it's here. It's everywhere. And so
that sounds like another conversation.
It is.
Day.
Yep.
I promise that if somebody found a writing implement tool and a piece of paper, you would repeat that phone number
I will repeat
if
that
individuals
phone
would
number.
like to get a hold of you, Christine, or the other folks,
absolutely,
that is a possibility. Because again, what if they don't have insurance though?
So we do take different types of Medicaid insurance,
Good.
but we also have grant funding. We have funds for families or children that are victims of crime, which would include some of the things we've mentioned.
So again, you'll give them the resources to look at so that the money piece of it should not be an obstacle or a barrier to giving you a call.
And not only that, we will work with other agencies. We have a great relationship with some of the agencies so that we can refer back and forth for different things because at the bottom line, it's just about that child getting that help. And
this is about you getting the help that you need for your family, for a great friend, for those that you think could really use the help. So Matt, I'm going to let you finish up the number.
The number to call to get an appointment with Hibiscus Outpatient Community Mental Health Program is 772-340-5750, extension 170.
So thank you very much for being here today, folks.
Thank you.
And thank you for being online with us, listening to this conversation. We do have all the media stuff that you could imagine if you want to see our smiling faces. I know this has been a very serious subject, but sometimes in our business you have to laugh or you'll just end up crying, and then you can't move ahead. So that's our hope, to make all of us have a healthier, better life. Thank you, guys.
Thank you.
And we'll see you next week. Have a good evening.